Welcome to the Ordinary Doula Podcast with Angie Rozier, hosted by Birth Learning, where we help prepare folks for labor and birth with expertise coming from 20 years of experience in a busy doula practice, helping thousands of people prepare for labor, providing essential knowledge and tools for positive and empowering birth experiences.
Hello and welcome to the Ordinary Doula Podcast. My name is Angie Rozier. I'm your host, and as always, I look forward to being with you and spending a little bit of time with you. I wish we could hang out in person and chat with each other as we discuss so many different aspects of pregnancy, labor, birth, postpartum, breastfeeding, all of those things. So today I want to talk to you about something that I find fascinating and frustrating, and something that I use as a yardstick, if you will. It's kind of like my measuring tool as to, I don't know if success is the right word, but brilliance maybe in the birthing world. And I guess like if I look at this measuring stick, depending on how we're utilizing this and how we're avoiding this, and percentages and prevalence and probability, like this kind of gives me a good idea of I don't know, provider style and things like that. And that is cesarean rates and or the use of C-sections for labor, delivery, and birth. So we know that the C-section rate in the United States hangs out around 30 to 33%, and it's been that way for a really long time, like over 20 years. I pulled some stats from a nearby hospital local to me, and so far this year in 2026, the first 3 months they are hanging right there. They're at about 29%. Fluctuates by the week, of course. They get as low as what I've seen, like 25%, but they're hanging out about 29% for 3 months or so. So that's holding true there. And I'll have to do a whole nother episode on cesarean section and NICU stays too. That's kind of interesting. We know that the likelihood of a baby going into the NICU goes up when they're born by cesarean, and they're more dangerous to moms. I'll save that for a different episode. But kind of using it as a measuring stick, like how to avoid them. Why is the rate so high? There's lots of different factors that go into that. So because about 1 in 3 babies in the United States are born by cesarean, there are things you can do during pregnancy and during labor that can reduce the chance of an unnecessary cesarean. So there are necessary C-sections, and this is a procedure, an operation that we are incredibly, incredibly grateful for. We're good at it in so many places. It's actually, as for a major abdominal surgery, pretty simple as far as we've done it a lot. We've got it down to a really good science. We can keep the risks of major surgery low. However, the risks are still there. So the things you can do during pregnancy, right? And during labor, we can't control everything, but there are definitely some things we control. So yeah, I want to normalize to that balance of realizing some cesareans are necessary. There's some, people are on both sides of this issue, of course. I teach childbirth classes at a couple of local hospitals, and had a student in one of my classes recently who she just wants a C-section. Like that was her plan. That's what she wanted. That's what she's most comfortable with. I don't know if she's looked into it and all her options. She was kind of upset when her provider said, no, I'm not just going to do an elective C-section on you. And no, we're not just going to do it 37, 38 weeks or whatever. So there's people on that side of it. There are other people who are absolutely devastated if they have to have a cesarean. And then there's a lot of people in the middle, right, who are like, yeah, I had a C-section, and it doesn't, they might not want it per se, but it doesn't kind of crush their world if they have one. So kind of, I guess the goal here is having informed preparation. Like when you know how to prepare either to avoid one or to have one, prepare for a C-section, that supportive care can help us feel more confident in our situation, actually, in avoiding or accepting true need of that. So, one of the biggest things you can do is select a provider who likes to avoid cesareans, a provider who's going to support you if that's what you want, right? A provider who's going to support you in avoiding a C-section. It's going to be a huge one. So talking to them about that, like they know these statistics, whether they share them or not, but ask them how many of their first-time moms, if you are a first-time mom, have C-section. Like, what is their C-section rate? That'd be a primary cesarean, we call that. You can also ask, like, how long have you seen pushing last? And there's so many different factors to that. Not like how long do you allow for pushing, but how long have you seen it go and have it still be a successful vaginal delivery? My top that I've seen pushing with a vaginal delivery is 9 hours. Now that's wildly long. I've seen 6, 7, and 8. And a couple years ago, a 9 that resulted in a vaginal delivery. Pretty unique circumstances there. And sometimes we see a lot of pushing 6, 7 hours. And usually providers don't like to go more than 3 or 4. We have to have a really strong case that it might work. A patient who's willing to do the work and a patient who's patient enough and strong enough to keep going. That's a piece of it as well. But yeah, so ask kind of how long have you seen pushing work? And then what do we do about, ask your provider, what do we do about a slow labor? Like, what are you going to do about a slow labor? Because we got to understand sometimes labor is super slow, especially those early stages. We got to be patient and let it kind of take its course in a very cautionary way. The midwifery model of care often has lower cesarean rates. There are hospitals, every hospital has their own climate, if you will, their own culture about how they approach labor and birth. Some hospitals have lower C-section rates and lower intervention rates. Some hospitals have higher NICU admissions. Some have high induction rates. So kind of ask around, get some data on the hospitals that might be available to you as well. But this goes to show that there's a pretty impressive impact of your providers and your place policy about this. So where you give birth and with whom you give birth matters almost more than anything else in whether or not you're going to have a cesarean. So also before labor ever begins, there's some things you can do to prepare your body for labor and prepare to, if at all possible, avoid a cesarean. And it is most of the time quite possible to avoid a C-section. So preparing your body, realizing labor progresses slowly sometimes, and it can progress smoothly when the body and the baby are well aligned. So that, like, movement, if I could have people do one thing during labor, it would be to move, like regular movement, upright positions, walking. And this is during pregnancy, right? We are a reclining society. We recline a lot. And movement will be helpful to that. So that's pelvic mobility. That's helps facilitate good fetal positioning. So things you can do during pregnancy. There's great websites like Spinning Babies that's going to be very helpful to get you to understand how babies rotate, how they descend. They'll help you kind of map out where your baby might be in your body. Also, prenatal chiropractic care that helps align pelvises. So the pelvis is in alignment. It's not going to be torqued. It's not going to be tipped. It gives like the straight shot for babies. So kind of focus on some comfort, balance in the pelvis throughout the pregnancy period. And you do have a nice opportunity to work with the pelvis during pregnancy because the hormone relaxin is helping everything to be pretty responsive to movement, which is nice. Another thing that is really not mentioned a whole lot, to my great dismay, is nutrition. Like, if you can pay attention to pretty awesome nutrition during pregnancy, that can impact your chances of having a cesarean. So focusing on protein, like pretty good intake of protein, 100 grams or more is going to be awesome during pregnancy. The baby's body, every cell in that baby's body is built of amino acids and protein. The cord, the placenta, as you build these things, protein is the building blocks for that. And also avoiding white sugars, white flours, going for protein, and then fiber, vitamins and minerals found in fruits and vegetables of all awesome variety. So that helps us not get babies who are kind of too big. We see trends in the United States, and one of them is increase in gestational diabetes, increase in preeclampsia. There are a lot of factors to this. Nutrition's not the only one, but certainly a very neglected one. So please, during pregnancy, eat well. Eat kind of like you're a diabetic and learn what that means. High protein, low sugars, no sugars, high fiber. That's going to be something you can do during pregnancy as well. Whether you're 4 weeks pregnant, just early on in the process, whether you're 30 weeks pregnant. I was teaching a class the other night, and some of these people, their due date was still, 4, 5 months out, and they asked the question like, hey, what can we do now to avoid C-sections? And we talked about nutrition. Their providers had never talked to them about nutrition. So please look into we do have some podcast episodes here about nutrition during pregnancy. That's a very neglected item. Another thing to do, and this is early labor, like during labor, is stay at home during early labor, like when it's safe to do so, right? When it's smart. Look for any warning signs, of course, but going to the hospital too early can increase the opportunity you have to be offered and to accept and to be given interventions, right? So in early labor, eat and drink, hydrate yourself well, nourish yourself well, balance yourself between rest and movement. Be upright, walk, shower, employ some nice comfort measures in those early stages when labor is kind of manageable. Um, and so kind of avoiding going to the hospital until contractions are strong and consistent, until you can't talk through them, until they're coming every 3 minutes apart if it's your first baby, maybe 5 minutes apart if it's a second or third baby. They're lasting at least a minute. That's been going on for an hour or more. A lot of people get really anxious when labor begins, or the partner gets really anxious, like, hey, we got to get there, we got to go. Maybe you don't. Maybe stay at home during early labor. Another thing that will help avoid cesareans is continuous support during labor. So that can be, we know that research shows consistent support can lower C-section rates for a lot of reasons. Part of that's emotional. Part of that's helping you know it's normal and helping you be patient through normal processes. Part of that's incorporating comfort measures. Movement's huge. So support can come from a really knowledgeable partner who's going to be with you every step of the way, who's learned with you, who can employ strategies to help you through a long or a short labor. That could be a trained doula, getting someone who is really, this is their job, right? To help people through the labor process. A really supportive nurse. Now, we don't know until we get there who our nurse will be. Could change every 12 hours. I was just at a birth earlier today. We had 3 shifts of nurses, 1 hour with one nurse, 12 hours with the next one, and 1 hour with the same nurse we had the night before. Both nurses were phenomenally supportive. Of everything. And this client had some pretty specific requests, and the way she communicated those to the nurses got them on her team right away, and they were phenomenal with her. So supportive nurse, and win your nurse over. Like, be good to your nurse, appreciate your nurse, get your nurse on your team. And a supportive midwife, like midwifery care, is phenomenal for helping. A lot of times midwives will have lower cesarean rates than OBs do, because of their approach. Actually, there is one midwife I worked for many years, and I worked with her as a doula for dozens and dozens of births together. And the way she prepared her patients all along through all their visits during pregnancy was unique. And she took her time with them. She educated them. She listened to them. She gave them tips. She gave them confidence. She empowered them all along the way. And she helped them with a lot of these same tips, actually. She's like, stay at home during early labor. She gave them confidence in the process, confidence in their bodies. And a lot of times I was with her at 3 different hospitals and a birth center over the years. And her patients, and the nurses said this a lot, they noticed it. Her patients came in advanced labor. They came in confident. They came in comfortable. They were well progressed in labor. So they got down to the business of having a baby pretty quickly after they got there. That was just how she kind of led them over the course of their time together during prenatal visits and pregnancy. So that was, to me, a little snapshot of the potential of a provider and how a provider can prepare patients, empower them, and kind of have an impact. Like she had a pretty broad impact on her patients because they would come in very similar states, confident, empowered, and in advanced labor, ready to have a baby. Not long after they got there. I'm not talking like imminent birth, but they were oftentimes 6, 7, 8 centimeters by the time they came. They had the tools. She empowered them with tools to use in early labor and partners as well. So that can be really important, like just how you prepare mentally as well as physically and emotionally. So when you have a supportive partner who's knowledgeable, can help, or a midwife or a doula or a supportive nurse, that can actually shorten labors, right? Like when the body and the brain and the mind and the heart are not nervous, not tensing up, when they can be confident, that can shorten labors, honestly. It can lower the need of interventions. It can increase satisfaction with the birth experience. It can decrease cesarean rates. Um, so please seek out support. There's lots of different ways to get support. And then one of my favorites is mobility. Protect mobility during labor. Strive for mobility and movement during labor. Change positions frequently. Movement helps babies to rotate and descend. One of the biggest reasons that a lot of C-sections are recorded is, well, we got fetal intolerance is quite common. Maybe positional like breech or transverse or something, but a lot of times it is what people call is my baby got stuck, my baby was too big. But movement, sometimes that's a little questionable in my mind. If we hear a baby's too big, like pretty rarely are babies too big, but sometimes they're not given the chance to have the mom's body in positions and to move enough so that the baby can make its way down through the pelvis. So upright positions are awesome. Gravity is your friend. Walking is great. It moves that mid pelvis. Using a birth ball, using a tub, using a shower, that gives you some great upright positions as well. Being on hands and knees is fabulous. And doing these positions during pushing as well, if we're having a longer second stage or longer pushing. Even after, if folks get epidurals, sometimes I mean, especially after epidurals, we want to focus on position changes. We're not just a beached whale after you get an epidural. It's really important to continue those movements using upright as much as you can, not out of bed, of course, but upright positions for a little while. Some really awesome side lying things with some exaggerated positions will help that baby rotate and descend. We got to give that baby every chance. We got to help out that baby. Another one I see a lot is people aren't patient with the labor process. This could be providers not being patient. They like want to move things along. They're getting nervous about stuff. And yeah, there's signs we want to look for and be smart about. But we know labor can take a while, especially if we're inducing for whatever reason. If we're inducing early, if we're inducing a cervix, it's not super ready or prepared. Yeah, that's going to take a while. It's going to take a hot minute. I have had 4 clients in the last 5, actually. 4 be induced and 1 had spontaneous labor at 37 weeks. The 4 that were induced, it was for different reasons. One's for intrauterine growth restriction, 2 were for preeclampsia, 1 was for twins, but every single one of them, and then 1 had spontaneous, just boom, she had a baby at 37 weeks with no prompting from an induction. But when we're pushing a cervix at 37 weeks, we got to know it's going to take a minute. That cervix probably isn't super ready to do some movement. So be patient. And when patients are patient, the provider can be more patient. When the provider's more patient, the patient can be more patient. So I want you to go into inductions, especially early ones, realizing that it'll take some time. I have honestly, it's not common, but it can certainly happen. I've had people get induced on a Monday, maybe late at night, and have a baby on a Friday. And have not a cesarean, but a vaginal delivery. Sometimes it does take a while, and most of that time is spent kind of ramping up, warming things up. So early labor can take longer than we once thought. Some of the literature we've seen, or even in books and stuff, the guidelines is that it might take 12 hours. Well, sometimes it's 48 hours. Like it can be a slow process. And also realizing that pushing second stage, right, can take a while in first babies, especially 1 hours, 2 hours, 3 hours or more can be normal, and change position even with pushing. So as you are patient, and a lot of times I see a partner who's not patient, or I see, they get worried about things. And so if you have someone there to help normalize, yep, this is normal. Yep, your baby's doing well. Yep, we're gonna be patient. We're gonna give it time, and have some things to do. Be prepared for that 1 day, 2 day, 3 day induction process can be helpful. Sometimes it's the woman herself who's impatient. Um, Sometimes it's the provider who's impatient. Sometimes it's the nurses who are impatient. Sometimes it's the time of day or the holiday. You wouldn't believe how many people try to have babies right before a holiday, right? So we're kind of pushing it. We're not being very patient. There's a statistic that's been rolling around for a long time that the most common times for cesareans in the United States are 4 p.m. and 10 p.m. on a Friday. So I wonder, what kind of leads to that. Are we patient as we're going into a weekend? Um, and then sometimes the pressure comes from other family members. So often also in a long, slow, expected labor process or induction process, we've got grandmas or sisters or family members who are kind of pestering, texting, calling and saying, why is she still pregnant? I can't believe they're still letting her be pregnant. Well, sometimes things take a while. People need to know that. There are some things when we know a cesarean's the right choice, right? Placenta previa. Of course, we're going to get a C-section. The placenta is covering the opening, right? The cervix. Baby can't go through that. Some fetal distress situations that, gets a lot of C-sections happening actually. And, a little controversial on how accurate that is. Sometimes breech situations or other positions. We don't have a whole lot of doctors in hospital who deliver breech babies. It's kind of a lost art at this point. Complications sometimes during labor for mom's health. Seen a lot of preeclampsia lately. Sometimes we'd have emergencies that come up like a placental abruption or a prolapse cord. So the placental abruption, the placenta kind of starts coming off the uterus. The prolapse cord, the cord kind of comes out before the baby's head. Both of those situations are very fast C-sections. So again, C-sections aren't bad, evil, or wicked. They are just super overused. And that's kind of the current reality that we're living in. Nobody's, out there to, do a whole lot of damage that way, but that's kind of where we're at. And we could all kind of make a difference in our approaches to kind of lower those. So kind of what I want to empower people is there are some things you can do to avoid C-sections. As I was teaching childbirth classes in the last few weeks, we talked about this. One of my classes had 9 couples in it. I'm like, all right, so 3 of you statistically are going to have a C-section. And that was pretty disturbing to the class. Another class had 6. I'm like, all right, at least 2 of you are going to have C-sections. Who's it going to be, right? And nobody wanted it. There are some people who do want a C-section and be fine with it. But I want people to know that there are things you can do before and during labor, and even as you plan who and where you're going to have a baby with. That is going to be helpful as well. So ask the questions, right? Ask questions to providers. Build a strong relationship, strong connection to your birthing team, whoever that is. Trust your body. Remain flexible to how things go. Be patient with the process and move. Just move it, move it, move it. There's that cute song from Madagascar, I think, of Move It. So I want you to take these hopefully empowering tips into your birth process, your labor process. If you're early on in your pregnancy, there's a lot you can do ahead of that. And kind of enjoy your journey as well. Make sure to enjoy the journey. And yeah, some people do have cesareans, and we're super glad for them when they do. They have improved a lot over the years, and we're so grateful that they are there. So take that info for what it's worth. Hopefully it will help you in some way. This is Angie Rozier signing off from the Ordinary Doula podcast. And please take time to connect to someone. Human connection is so important. You never know when somebody will need a wink from you, a hug, or a quick hand squeeze. But please make a connection with someone. Tell them today that you love them. Hopefully you'll be back next time. Thanks for being here, and I'll see you soon.
Thank you for listening to the Ordinary Doula podcast with Angie Rozier, hosted by Birth Learning. Episode credits will be in the show notes. Tune in next time as we continue to explore the many aspects of giving birth.